Kids Multi-Zero Chewable Tablet Multivitamins are used to treat or prevent vitamin deficiency in children. They are important for the overall health of the body and can be taken to supplement a poor diet, certain illnesses, or during pregnancy. The recommended daily dosage for children is 1 tablet. It is best to take these multivitamins with a meal to maximize absorption. Remember to consult with a healthcare professional before starting any new medication or supplement. Make sure to chew the Kids Multi-Zero Chewable Tablet Multivitamins thoroughly and swallow it once a day as directed by your doctor or the instructions on the product package. It's important not to take more than the recommended dosage. To get the most benefit from this medication, take it regularly at the same time each day to help you remember. If you have any questions, be sure to ask your doctor or pharmacist for guidance. Some common side effects of Kids Multi-Zero Chewable Tablet Multivitamins include constipation, diarrhea, or upset stomach. These effects are usually temporary and may go away as your child's body gets used to the medication. If any of these effects persist or worsen, it's important to notify your child's doctor or pharmacist. It's important to remember that if a doctor has prescribed this medication, they have determined that the benefits outweigh the potential risks of side effects. Most people who use this medication do not experience serious side effects. While a severe allergic reaction to this medication is rare, it's crucial to seek immediate medical help if your child shows symptoms such as rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or difficulty breathing. This is not a comprehensive list of potential side effects, so if you notice any other effects not listed here, it's important to contact your child's doctor or pharmacist. If you're in the US, you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. It's important to keep Kids Multi-Zero Chewable Tablet Multivitamins out of reach of children, especially if it contains iron. Accidental overdose of iron-containing products is a leading cause of fatal poisoning in children younger than 6 years. If overdose does occur, it's crucial to get medical help right away or call a poison control center. Remember, safety first. Before giving Kids Multi-Zero Chewable Tablet Multivitamins to your child, it's important to talk to your doctor or pharmacist if they have any allergies to the ingredients in the product. It's also important to discuss their medical history, especially if they have had alcohol abuse, liver problems, or stomach/intestinal issues. If the multivitamin contains folic acid, it's important to inform your doctor if your child has a vitamin B12 deficiency, as folic acid may affect certain lab tests for this deficiency. It's also important to consult with your doctor or pharmacist if your child has phenylketonuria, PKU, or any other condition that requires them to restrict their intake of aspartame, as this medication may contain aspartame. Before any surgery, it's important to inform the doctor or dentist about all the products your child is using, including prescription drugs, non-prescription drugs, and herbal products. If your child is pregnant or breastfeeding, it's important to consult with a doctor before using this medication. Drug interactions can affect the way your medications work and may increase the risk of serious side effects. It's important to keep a list of all the products you use and share it with your doctor and pharmacist, including prescription/non-prescription drugs and herbal products. Always consult with your doctor before starting, stopping, or changing the dosage of any medicines. If your multivitamin contains iron, it's best to avoid taking it at the same time as antacids, bisphosphonates, levodopa, thyroid medications, or certain antibiotics. Ask your doctor or pharmacist about how long you should wait between doses and for help finding a dosing schedule that will work with all your medications. If your multivitamin also contains folic acid, be sure to inform your doctor or pharmacist if you take certain anti-seizure drugs. It's important to note that this medication may interfere with certain lab tests, possibly causing false results. Make sure lab personnel and all your doctors are aware that you are using this drug. If a person has taken too many Kids Multi-Zero Chewable Tablet Multivitamins and is experiencing severe symptoms like fainting or difficulty breathing, it is important to seek emergency medical help by calling 911. Otherwise, contacting a poison control center is crucial. In the U.S., residents can call their local poison control center at 1-800-222-1222, while Canadian residents can reach out to a provincial poison control center. Symptoms of an overdose may include stomach pain, nausea, vomiting, and diarrhea. It is important to seek medical help immediately in case of an overdose. Remember to keep all your scheduled medical and lab appointments. It's important to note that these chewable multivitamins are not a replacement for a healthy and balanced diet. It's always best to get your vitamins from nutritious foods. Make sure to maintain a well-balanced diet and follow any dietary guidelines given to you by your doctor. And remember, it's always a good idea to talk to your doctor before starting any new supplement. If your child is taking this multivitamin on a regular basis and happens to miss a dose, they should take it as soon as they remember. However, if it's close to the time for their next dose, they should just skip the missed one and take the next dose at the usual time. It's important not to double the dose to make up for the missed one. As for the best time to take this multivitamin, it's recommended to take it at the same time every day to help establish a routine. Make sure to store the kids' Multi-Zero Chewable Tablet multivitamins at room temperature, away from light and moisture. It's important to keep it out of the bathroom and away from children and pets. When it's expired or no longer needed, be sure to properly discard the product. You can consult your pharmacist or local waste disposal company for the best way to do this. And remember, don't flush the medications down the toilet or pour them into a drain unless specifically instructed to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.